Hello and welcome to the Penny Dee Podcast. This is for you if you would like to sit for 20 to 30 minutes every month, relaxing your mind and just listening to my ramblings about life, love, happiness and much more. I'm your host, Penny Davis, and welcome to the show. Welcome to the show, Dr. Louise Newson.
Thank you for inviting me. It's great to be back.
Oh, and thank you. And last time we covered perimenopause. Very important, lots of information there. Today we're going to talk about testosterone.
Yeah.
Now, you're just back as well from a tour in Australia. Was it Perth, Sydney and Singapore?
Fun as well. So, yeah, it was great, actually. Really good to be meeting like-minded healthcare professionals, but also lots of amazing women and a few men, actually, keen to learn more.
Oh, good to know, yeah. And I'm sure you have learnt so much from talking to all of those different people as well and the different perspectives.
Yeah, absolutely. But it's also really reassuring, actually, because a lot of the people I met were really good clinicians. You know, they've got good clinical knowledge and experience. And, you know, we're sharing similar stories about different patient effects and improvements in hormones, especially testosterone as well. And so it's great to know that what I'm doing in my clinic is no different to what other people do in other clinics across the world as well.
That's very reassuring.
Yeah.
And the testosterone conversation for me, it was the piece of the missing jigsaw in terms of my own HRT, which we'll dive into why, because it is a very misunderstood hormone for sure, but is one that can be a real game changer. So we'll get straight into it. Why do you think testosterone is, the missing link here, not talked about?
Yes, it's really important, isn't it? Because we've always been told estrogen and progesterone are women's hormones and testosterone is the male hormone. Whereas actually, what's really interesting is that men produce estrogen and progesterone as well. But we produce testosterone and we produce more testosterone than estradiol when we're younger. And it's the most biologically active hormone we have. So we have cells that respond everywhere in our body to testosterone. But it's been forgotten. It's been almost ignored for far too long. But if you look right down into cellular processes, and I'm really interested in the way our bodies work and how they don't work, we don't have certain things going on. But testosterone affects every single cell, every cell process. It affects the way that our bodies and brains and organs function as well. And it's made in our ovaries, but it's also made in our adrenal glands, which are just little glands near our kidneys. But really importantly, that a lot of people still don't realize is it's made in our brain as well. So it's not just a hormone that might or might not affect libido. It affects every single cell function in our body. And levels decline with age. So it's not a menopause-related decline. It's usually an age-related decline. And levels can start declining in the late 20s, actually. Because about half of our testosterone is made in our ovaries, if someone has a surgical menopause, so they have their ovaries removed at a young age, then of course they're going to become more testosterone deficient quicker.
Right. I'm absolutely blown away there. I knew there was the link with the brain, but it's made in all different parts of our body.
Yeah. So it's made, but it's also, if you remember, like hormones are just chemical messengers that go into the bloodstream. So they're made in various organs, go in the bloodstream and then go to every single cell in our body. So the testosterone that's made in our ovaries, adrenal glands will still get to every tissue, every cell in the body.
And that would explain why when I introduced it to my HRT, everything changed. So my body felt better, my mental clarity for sure I went back to a faster thinking era. Obviously, my libido was improved as well, which was why I had initially looked into it. But the benefits I got were immense and were far reaching for me. And my happiness level. And I remember reading something that you'd written about your serotonin and testosterone is an anti-inflammatory. So can we talk about, we associate it with muscles and men, but really, does it bring to women in HRT?
Yeah, so lots actually. So when we prescribe testosterone, all we're doing is prescribing the missing amount. So people often seem very scared about side effects. They think that women are going to turn into bearded monsters and they're going to have deep voices and acne. And like, I've taken testosterone myself for 8, 9 years now, and I do not shave every morning when I come to work. But what I'm doing is topping up what's missing. And so also it's just a natural hormone. So we're replacing like with like. People who inject testosterone um, have a synthetic testosterone, so it's not the same structure. And that makes a big difference because there's more side effects and risks with the synthetic types of testosterone. But using it as a cream or gel through the skin at the right dose will just go into the bloodstream and affect in a positive way all those cells around the body. So a lot of people notice that their mood, energy, concentration, sleep, muscle and joint pains, headaches, even migraines can improve. And like you say, people just feel happier. It's that sort of, I often describe it's like opening the blind in the morning and the sun is shining and you're like, good, bring it on. It's going to be a good day. Whereas if you don't have testosterone, it's like, so what? Like, it's just the sun again. It's not really a big deal. Or, just little things like some of my patients say to me when they take testosterone that they singing in the shower again. They're like not shouting at the children. It's easier just to get on with life. And those things are quite hard to monitor in studies, but actually we don't have to have everything monitored in studies. And it makes sense because our brain is lit up. It's easier to function, like you're saying. It has really important roles in the brain, and it can affect the level of other important chemicals in the brain like serotonin and dopamine, which will help with our mood, help with the way we feel about things. So yeah, and it's very anti-inflammatory in our muscles and joints. It helps build muscle in a good way, not in a sort of bodybuilding sort of way. It's good for our bone strength as well. A lot of people with urinary symptoms can really make a difference with testosterone too. So yeah, if people have symptoms related to low testosterone, then those symptoms improve if they have the right dose and type of testosterone. It could take a few months to have an effect. But the biggest difference in my huge clinical experience is the improvement with mood. Without a shadow of a doubt, people who have been very low, very flat on lots of antidepressants, sometimes antipsychotics or lithium, they're the ones who really improve with testosterone.
I didn't realize they still prescribe lithium and things for that type of
Yeah.
low mood. Right. And actually something you were saying there really resonated with me. When I went into my menopause and all my symptoms were really coming to a head, I would wake up in the morning as someone who'd always woke up, flung the curtains over. What have I got today? Before I've even opened my eyes, I went to like meh.
Yeah.
I just didn't really care what I had on today. I had to get through
Yeah.
the day, and that was what I
Yeah.
could really notice. The other thing about the symptoms there, about women being warned that their voice might go deep, that they might get pain, male baldness, and all kinds of bizarre symptoms, but they would have to be at massive doses, wouldn't they?
Yeah, for sure. And everyone is different. But yeah, we don't usually see side effects because we are literally just replacing what's missing in the female range as well. So sometimes if people have had skin changes like acne when they were teenagers, sometimes they could be more prone to that because you're basically resetting to how their bodies were when they were younger. But I've seen one lady who has had voice change, and she actually had bought testosterone through a website and was using the male amounts. She felt great, by the way, but her voice had changed. And she was a singer, and it was a big thing for her. And so actually when she was on a lower dose, initially she stopped it and her voice improved, but then she felt dreadful. She felt so tired. So now she's on a normal female dose and her voice is a lot better. But she said, I'm prepared to take the risk of any voice changes because I can't function without it. But I've not seen other, voice changes or irreversible problems. Some people get some hair growth where they rub it.
Yeah.
People normally apply it onto their thigh and it can stimulate the hair follicles there. But most of us, if your brain's working and you feel better, you can cope with a bit of hair growth on your thigh. But people are very scared. In the guidelines, it's mentioned that we can consider testosterone if people have reduced sexual desire despite taking HRT. And so but most women do have some reduced sexual desire. So we can give it for that reason. Um, some menopause societies say women have to have something called HSDD, which is hypoactive sexual desire disorder, before even thinking about testosterone. But I have a real issue with that because one of the criteria to have HSDD is that women have to be severely psychologically distressed with their reduced libido for at least 6 months. And, I went into medicine to help people, not to watch them be severely psychologically distressed for anything, let alone for 6 months. So, again, it's about choice. Lots of things in medicine we give to see if it helps people. And if it doesn't, we try something else. But I don't understand why it's so hard for women to get a natural hormone prescribed for them.
Wow, we're back to that cultural acceptance of women suffering, aren't we?
Indeed. Yeah.
It's terrifying still. Absolutely. And people could just try it, couldn't they, at a small dose, like any of the hormone replacement, and see how they are. Now, a word from our sponsor. Do you want to address the signs of aging or menopausal skin? Does your skin feel dry or sensitised? Try my very own brand of skincare. Skin Goal Skincare is a powerful, clinical, yet luxurious range of products, all designed with you in mind. Try it today. Get 15% off your first order. Use the code podcast15. Enjoy. Now back to the show.
So often in the clinic, for example, here, we do a baseline blood test to see what the level of testosterone is. And it's only a guide, but it's just quite useful. And then we start testosterone if we think it's clinically indicated, and then repeat the blood test after 3 to 4 months when we review people. If the level is still low and women are still having symptoms suggestive of testosterone deficiency, we might increase the dose or change from the gel to the patch or vice versa to try and improve absorption. And then just review and see. It can take 6 months to have a full effect because the dose is very low. It takes a while for the cells to work out how to function in the presence of testosterone. Some people feel a lot better very quickly, and some say, it's taken a while. And then suddenly I think, wow, yes, I feel better. There's very few people who don't benefit. But the thing is, I always say to people, it doesn't last long in the body. So if you decide you want to change your mind or stop it, it will be out of your body the next day. So it's not harmful to try something.
Yeah. And like you say, it is a naturally occurring hormone for us, isn't it?
Yeah.
And just on that, if you could just clarify the difference between the male and female testosterone and then the different delivery systems.
Yeah. So the actual hormone is exactly the same. It's called, it's annoying, it's called testosterone because test is from the test and we don't have testes, but it's the same biochemical structure, the same whether it's men or women. But understandably, women have less than men. So when we just prescribe lower doses. Now, one of the problems in the UK is we don't have a licensed preparation. So men have a licensed preparation. Of course they do. But of course women don't. So, but we can prescribe things off license. So, for example, in medicine, lots of things we prescribe off license. There's very few drugs actually that are licensed for children, but we know they're safe, we know they're effective, so we prescribe them. And so testosterone is no different. We can prescribe the male version off license, but obviously we just recommend people have lower doses. So it's usually, this is very general, about 1/10 of the dose of a man. Then that's the gel. I usually prescribe the sachets because women can just either paperclip or put them into a pot and then they can work out. There is a pump, but then it's quite hard to do 1/10 of a pump, and then I know some specialists recommend doing it every other day or every third day, but I think it's too messy. It's easier to do the same every day. And then we've got the cream, which is called Androfen, which is the one that's licensed in Australia. And it's just a small 1/2 ml. So it's like a large pea size that people rub on every day, but it's the equivalent dose to the gel. The advantage of the gel is that if you can get it prescribed by your NHS GP, then it's under the NHS. The advantages of the cream is that it's made for women, but it's still the same hormone within it. So it's often a personal preference. Other formulations, such as, like I say, the injections, some men have them, but we don't prescribe them. For women, because they're synthetic, they've been chemically altered. So we stick to the real deal, the real testosterone, really.
And that's reassuring that that is also the bio
Mm.
version, because I
Yeah.
wasn't clear on that, and I have the sachets, and
Yes.
they're very easy to use. Um,
Yes.
So for women who say that it's been a game changer for them, is this the same in their other HRT, that they can just stay on it, that they're not going to magically start making their own testosterone again like their others? Is it fine to take long term?
Yeah, we don't have studies because there's been no studies, but we don't have studies for lots of things long term. But we do know that women have been around for many years with their testosterone without any problems. And so we know that it's obviously can help our mental health, it can help our physical health, it can help our bone and hearts and so forth. And the guidelines are just monitor people every year. So when we see people who are on testosterone, we usually do a blood test. We obviously see if they've got any side effects, which they don't usually have, and ask them if they want to continue or not. Most people do continue. I've had some people that say, "Oh, I'm not sure if it's making much difference," and they stop taking it and go, "Oh my goodness, yes, it really was making a difference." um, because it can be quite subtle,
Mhm.
It's but it's all about choice and trying. What is really frustrating is for most women that choice isn't there because they're being told they can't have it. And someone actually messaged me on my Instagram at the weekend to say that their GP surgery has got a policy where they don't prescribe testosterone. End of. What could she do? Like, I just find it really, like, it's 2025. I don't really understand how doctors can control women in this way.
It is incredibly annoying. And actually, just going back to the mental health, was it your study, Louise, where you found 28% of women could come off their
Yeah.
antidepressants? Yeah.
Yeah. So despite being a doctor who prescribes, I'm really happy to de-prescribe, as in take people off medication. I've done it for many years. I remember reading a study years ago to say a third of people who take blood pressure lowering drugs probably come off them. And this was about 20 years ago. And so when people's blood pressure is stable, I'd often try and reduce it. And it's amazing how as a doctor, you add in more and more medications and suddenly think, actually, does that person really need all those medications? So we see a lot of women who have been prescribed antidepressants, but also antipsychotics, even lithium. I've lost count the number of people who have had electroconvulsive therapy who've been misdiagnosed with depression related to their hormones. Honestly, you couldn't make it up. Yeah.
Electroconvulsion therapy, is that
Mhm.
the thing?
Yeah. Yeah. It's very sad actually. But once people feel better on hormones, and I'm not saying all mental health conditions, by the way, are due to hormones, but a lot of them are in women. Once they have their hormones balanced, often with testosterone, then we can start to think about de-prescribing, so reducing very slowly their antidepressants, their anti-anxiolytic medication, and maybe their antipsychotics as well. So we found that when people are on HRT, we can reduce, but when they're on HRT and testosterone, we can reduce further, which is really important because you know what it's like. For years, we've been told about risks of HRT, which have been perceived risks or misunderstood risks. But there are risks of taking antidepressants. And so if we can reduce those prescribing, then that's got to be a really good thing.
Absolutely. I'm still just just throwing me about the electroconvulsion therapy, actually. So
Mm.
do you still see this where women potentially are being prescribed antidepressants instead of addressing the hormone issues?
Yeah, we see it a lot. It's a lot easier to get antidepressants than it is HRT. If you think in the UK, it's about 14% of menopausal women are prescribed HRT, and it's probably nearly double that are on antidepressants. But a lot of people who come to our clinic have either been offered or prescribed antidepressants. And they often say, I know I'm not depressed. I feel flat, I feel joyless, I feel numb, but they're not clinically depressed. Even people that I've seen over the years who've been sectioned, they've been diagnosed with quite severe psychiatric illness, they've still got insight and they know that it's probably related to their hormones, we fund a PhD student in suicide prevention with Liverpool John Moores University. And, we've got some really good results already from her work, but showing the mental health aspect of perimenopause and menopause is so real and apparent, yet often misunderstood by mental health teams and psychiatrists. And once you understand how the hormones work in our brain, it's no surprise. And once you look at the evidence, there is evidence that all three hormones, estrogen, progesterone, and testosterone, can improve mental health. They can reduce depressive symptoms, improve symptoms of schizophrenia and bipolar, as well as ADHD as well. So, we can't keep ignoring the role of hormones in our brain.
Right. Wow. So on that note, if anybody feels like they want to approach their GP about getting testosterone brought into their hormone replacement, where is the best place for them to start? How can they, what information should they go armed with?
So I think the first thing with any consultation is to try and get as much knowledge as possible that's relevant for you as an individual. Obviously, download Balance, the free app. Go onto my website. There's lots of information. There's the articles, but also podcasts, YouTubes that I've done. There's a really good podcast I've done with a consultant urologist in America called Mo Kira, where we talk a lot about testosterone. So just have that knowledge is really important. And then if you think about, I've already said the NICE guidance for menopause say that we can consider testosterone if you have reduced sexual desire. And so guidelines are a guide, of course, but if you have reduced sexual desire, you would like to try testosterone, then I would say, look, I've read the NICE guidance, I've read about testosterone, I would like to try it. Sadly, I've seen some women who are not in a relationship and their GPs refuse to give them testosterone. I would also then maybe show them some evidence to say, look, there is evidence that it can help with my mental health. We did a study that was published just before Christmas showing that cognition and mood symptoms can improve when testosterone is added to HRT. So, find that, print it off, say to your doctor, look, I've seen that some data shows that there is an improvement in mental health and cognition, and I would like to try it. And then if they're not offered it, you could always say, what are your reasons for refusing it? And I can't understand why I can't just try it for 3 months and see. Because I think it's very reasonable actually to try testosterone, which is, like I say, it's very safe. There is evidence. You could argue that there isn't solid randomized controlled study evidence for every single symptom improvement, but there isn't for a lot of things we do in medicine, but it's about choice that's the most important thing.
Right. And if they get absolutely a dead end from there, presumably then they could come to a clinic like yours
Yeah.
and get a prescription.
So a lot of people come to our clinic for testosterone, but actually, increasingly, as we prescribe it and we write very detailed letters that go to the GP if the patient gives permission, once they feel better, they then are more likely to get it from their NHS GP. Because it's always harder in medicine to start something, but once you see the response, once you can see these people are well, they don't have side effects, their levels are normal, then it's easier. So increasingly, we're seeing patients who are able to continue to get it from their NHS GP.
So maybe come to yourselves initially, but they might pick that back up once it's a day for the GP.
Absolutely. Yeah. And that is happening more and more, which is really encouraging and really good.
And where should people go? What is your website? Where should they start to find out?
So, well, my website personally is Dr. Louise Newson, as in Dr. louisenewson.co.uk. And then the clinic is newsonhealth.co.uk. So having the information and then obviously Balance app, you can just get from Google Play or the App Store, which is free. So just getting that information and talking to others. I think women, I know women are good at talking, aren't they? And it's quite, you want to look at the evidence as well, but actually personal experience is really important. So if talking to others who go, yes, you know what, it's been a game changer, is fine as well. I was quite scared when I started testosterone many years ago because people weren't talking about it. I thought, well, I don't really know much about it. I've never prescribed it as a doctor. Will it work? Will it be okay? But I was so close to stopping my job as a doctor because I couldn't remember things despite being on HRT. The consultant said, well, you've got nothing to lose. You could just try it. And actually, like, it's been the biggest thing, the most important thing that's happened to me, really. And I wish I'd started it probably 10 years before I did. But you don't know what you're missing until you've got it back, do you?
So did you have a very forward-thinking consultant that you spoke to?
Yeah, I spoke to a very senior because I couldn't get normal HRT, as in estrogen and progesterone, from my NHS GP. So I went to go see him, and then I didn't really feel much better. So I was gutted because I thought everyone feels better on HRT. And my mother, who's taken HRT for decades, kept saying, "Aren't you feeling better?" So no, I'm not. Like, what's going on? And then he measured my estrogen level, and my estrogen level was low. So he increased the dose of estradiol to help the absorption. But he said, "Louise, your testosterone level is 0.4. It's really low. And you tell me you've got no libido. Why don't you add in testosterone? I'll prescribe it for you." It's like, "Oh, okay, okay." And it didn't, work initially. And then after about 4 months or so, I suddenly thought, my brain's coming back, feels sharper. I feel it easier to like remember patients' names and diseases and drug doses. And I could multitask easier. And I was remembering to pick the right child up at the right school at the right time, which was always good. Um, so yeah, and it's just suddenly you say, wow, gosh, I haven't had this clarity of thought for many, many years. And I had my third daughter when I was 40, but I was getting some symptoms before, and I think I'd probably been like it been gradually reducing.
Yes. Wow. That's, I mean, 9 years ago, was it, with the testosterone for you?
Yeah, so I started it, nearly 10 years actually. So yeah.
Gosh, no, because nobody was talking about it then, were they?
Not really. No, that's why I suppose I'm quite gobby about it, because I think it's not fair that I can get it and others can't. It's absolutely not fair. But the other thing is, since I've obviously, oh, well, before I took it, but since as well, I've spent a lot of time looking at the evidence, looking at research, looking at how testosterone works physiologically in the body, and getting down to real cellular, sort of very geeky but basic level in a scientific way, and just thinking, actually, it's all there. The knowledge is there, but people are ignoring it. And that's to the detriment and harm of women and their health, actually.
Do you think it's a cost issue in the NHS?
I don't know, because it's not that expensive. I think people are scared that there's 14 million menopausal women in the UK, and if they all ask for testosterone, it's going to be a bit of a stampede. But most people, including the patients we see here, once they're on the right dose and type of hormones, they hardly ever go back to their GPs. They're not on antidepressants, they're not on blood pressure treatment, they're less likely to be on statins, they're not on sleeping tablets. They're really enjoying their lives, and also they're working more. We have to remember that 10% or such of women give up their jobs because of their hormones. And the commonest symptoms affecting people's jobs are memory problems, anxiety, and fatigue. And so a lot of those symptoms will improve with testosterone. So it is short-term pain for longer-term gain.
Yeah.
We can't keep using it as a cost excuse or whatever workforce excuse, because everyday women are suffering because they're being denied a treatment that could help them. And morally and ethically, as a doctor, it just feels wrong.
And I always remember something you said, that you're in your menopause for a third of your life. And,
Yes.
personally, having hit my 50s last year, I am loving my 50s. I would be enjoying it as much without the correct hormones that I'm on now.
Yeah.
And just finally, as soon as we are doing testosterone for completion, could you take testosterone without estrogen or progesterone?
Isn't that a great question? Like I say, the guidelines say to add it onto HRT, but when you look at the evidence, when you look at how testosterone works, it is an independent hormone. I see quite a few women who have regular periods, but they feel very tired, they feel lethargic, they have recurrent urinary tract infections, they might have worsening migraines. Their testosterone levels are really low. So I'll give them a therapeutic trial of testosterone, and they feel so much better. And so, and also some women who've had breast cancer, their oncologist might be more concerned about them having estrogen, but less concerned about having testosterone. And there is some data that women, if they have testosterone after breast cancer, their breast cancer prognosis might even be better. And so increasingly, like I saw a lady this morning in the clinic who's using some vaginal hormones after breast cancer. but she's still very tearful, very low, very joyless, very flat. She's had breast cancer about 8 years ago. So she's going to consider having just some testosterone to see if that helps. So we can use it, it's individualization of care, which has often been lost. We share uncertainty with patients and say, well, we haven't got the best data, but we know it's a natural hormone. Would you like to try it? And then they often say, yes, please. That's fine. You can deal with uncertainty as a doctor. It's okay.
Of course. And one of the reasons I personally want to thank you for all of your work, Louise, because
Oh, thanks, Penny.
yeah, and many women I know as well, but it's about choice, isn't it? And having that, some people may choose not to, but it's about knowing what to ask for and the choice to have it. That's the important thing.
Yeah, and that is so crucially important. We choose as women whether we exercise or not. We choose what we eat. We choose whether we smoke or drink, and people don't often judge us for that. But there's something about hormones that we're judged all the time, and I don't really understand why.
I know. I did speak to someone the other day who blamed her mother and her mother's generation for being so stoic, towering.
Yes.
And I guess they didn't have a choice, did they, back then, maybe? Yeah, but we do now, and we need to keep advocating for ourselves, don't we?
Absolutely do. I think it's so important because we need to be looking at ways to improve our future health. It's not just how we feel now, it's how we're going to be healthy going forward. And that's really important.
Yeah. Oh, that's brilliant, Louise. I could speak to you all day.
Oh, thanks.
Thank you so much for joining me on today's episode. I've had a great time. I hope you've enjoyed it. And again, I would love to hear back from you. So all that leaves me is to say, have fun, be happy, and join me next time. Don't forget to hit subscribe for all of my episodes.